The NEET super specialty results are out. Congratulations to all those who got the rank. Now, lot of doubts among the residents or the doctors who gave the exam with respect to DM nephrology / or DNB nephrology. Few years back, when we take this NEET SS, you have to select the subject first, for example, nephro or cardio or neuro, then you will give the exam. Then subsequently the pattern was changed. In the previous pattern there was no confusion. You have selected the subject before, you went for the entrance, you gave, once you got the rank, the only confusion might be in selecting the institute where you want to select. But in the current pattern, the rank is open. Initially a student might be planning to some super specialty, for example cardiology. As the rank is bit better or in the borderline where he have to select between not, let us take DM nephro in a good institute versus DM cardio in some other institute, whether DM cardio or nephro or gastro or neuro, these kind of confusion many students are having. And another one, DNB or DM, what to do, where to select, so many doubts, so many email used to come. Subsequently, one by one we will see. In this video we will see regarding DM nephrology, what you are going to face in the residency times. With respect to DM nephrology, yes, the subject is more towards of medicine. The approach somewhat is going to be same as medicine. During the residency program of DM, the workload will be somewhat higher than your MD medicine. There will be interventions, lot of intervention. You are going to handle blood in and out almost most of the days of your residency. If you are taking in a place where AV fistula, arteriovenous fistula, if being done under nephrology department, yes, you have to handle those complications also. So first in the nephrology, what are the interventions are there? One is dialysis catheter insertion in the femoral, subclavian, IJV. The longer form of dialysis catheter, which is tunneled catheters, permacath insertion. You will be inserting in and out in internal jugular veins, femoral, subclavian veins, and inferior vena cava cannulation if the institute follows that program. AV fistula creation, aneurysm, fistula rupture, everything related to the fistula. Peritoneal dialysis catheter placement, acute PD catheter placement, chronic or CAPD catheter placement, kidney biopsy. These are all the core interventions the nephrology is all about. And similar to your MD medicine, in MD medicine, your residency, you might have got your second year, first year, third year all together in a particular ward. Whereas in DM, most of the time you will be posted alone. The workload will be somewhat higher in the initial first few months. You might feel it is very heavy, like that of thoughts you might get, but subsequently you might get used to it. Apart from the intervention, apart from the subject core, the third one is transplant, a new area which is not related to medicine, that also you are going to handle. Transplant, kidney transplant in a live related donor, in cadaver donation, how to manage. These are all the things you are going to see in the curriculum if the institute is having the transplant program. And another question resident always asks is, thesis, what about the thesis? In most of the institute, only one thesis have to be submitted. Yes, going to be a bit tougher than your MD, but you can do it. There are few institutes where two theses have to be submitted. Make sure you are knowing that before selecting the or putting the college in the hierarchy order, that you are going to select which are the college you want to put in the top order, the rankers. Just make sure you are having one thesis or two thesis. Please clarify that before your choice filling, okay, with by speaking with your seniors. And one more thing they always ask is, sir, is it better to take in a place where transplant program is already not running? See, 3 years you are going to do DM nephrology program. It is better to take in an institute where transplant is already there. There are few institute which provides DM where transplant program is not there. So in these institutes, if you finish, you will have difficulty in practically managing the transplant patient. You might get the theory, of course, through various sources, but practical level management is very, very important, for which institute with the transplant program ongoing is more better. But few students, in case if they are not getting the seat, what are the option? Yes, after your DM or DNB, you can do 1 year fellowship in transplant, which will fulfill your DM nephrology curriculum. And another call came today only. The student was asking, sir, why you selected DM nephro, not cardio or neuro? See, it might be a individual personal preference also, but overall, if you ask, nephro offers the after your after your DM. During DM, you are supposed to do intervention. You can't omit a particular area. Intervention, dialysis, transplant. Even if you are having some kind of disliking, you can't omit it during your 3 years of residency. But once you complete your DM nephrology, yes, you can have your style of practice, whatever you like. If you want intervention, yes, you can be into core interventions. Nowadays, they are doing the Doppler, nephrologists are doing the transplant artery Doppler, transplant kidney biopsy, all kind of intervention you can focus if you are a interventional kind of person. If some people during the DM residency only, they might get some kind of aversion towards blood, or because of some personal preferences, if they don't want to do intervention, yes, you can have a good independent. The hospital without nephrology is difficult to run, and you will have an independent practice. Diabetic, hypertension, nephropathy is very, very common. Giving the clearances, these are very important things where nephrologists handle. And another one is core program transplant. Few after DM, they want to go into the core transplant area. Yes, that also you can do. General OPD also you can easily manage, which are related to nephro. And nephro, most of the stuff are basically related to medicine only. Post DM, you will have all these options. Which one you want to select, accordingly you can decide and choose. So these are the info regarding DM nephrology. Yes, your residency time is going to be a bit difficult compared to your MD. And just a short overview I gave in this video. So as the question I am getting through the juniors and email, whichever the question, the doubts they are having, I will upload it as a video. At least it will be helpful to those who need this info. Okay. So in the next video, I will try to put the college order of DM nephrology during my times. Few were back, and my immediate junior and subsequently juniors were there. They might have put the colleges in a particular order. Probably I will try to upload that in the subsequent video. Bye bye, and once again congratulations for this NEET rank.